And feel free to interrupt me at any point or ask questions. I'm going to point a couple things out because I know people have different logins, and so there's default locations that we'll pick based off of your user account. But you can go to any user account by clicking this drop down up here, and so they all exist. My default is Glendale, so that's where I am. But if you happen to be at Levine or Camelback, all you have to do is switch this to the facility that you're wanting to look at, and it'll take you there. This screen right here is our dashboard, and so if you just want to see how we're doing in terms of volume, you could just hover over and just see the number of patients for the day. And these bars are actually clickable. So if I click on September 30th, that saw 64 patients, this will bring up basically a list of all the patients that are there or that were there that day. You can expand the number of patients, per page by clicking this drop down here, and you can go up to 100. And this external chart is our T-system chart. So if you happen to click on that, you can actually see the T-system output. All right, so let's talk about charting for OBS. I created the OBS test, CPSI test here, excuse me, in room 1 at Glendale. So there's some things that you guys have brought forward in terms of would be nice to add in, and those things are underway, specifically the time the order was started and the time the order was completed. Instead of being an internal timestamp, it would be something that will default to the current time, but you can edit it so that if you gave morphine and you wrote it down on the back of your glove and then got busy doing other things and then came back, you could be able to put the correct time, and that will be available in the next 1 to 2 weeks as soon as they finish going through all the QA testing and make sure it all works as designed. So to chart on a patient, you can click kind of anywhere along there. And so here's kind of a empty blank chart. Under medical history, we could put in medications. So if this person's on lisinopril, we can get lisinopril added in. And we could do allergies as well.
Okay, so Eric, when they put them in OBS, the first thing they'll do is click on medical history on the left.
Medical history right here.
Okay, so they don't click on nursing first because is that prior to OBS?
Yeah, so medical history could be entered by both the nurse or the physician. So it's not specifically just a doctor or just a nurse, so it has its own little zone. So medical history could be put in, surgeries, L&P, that type of thing. Social history, that's all in here. Stuff that is specific for nursing, and again, this is designed for an ER visit, so we're just using this for the OBS piece without the ER. So some of this obviously doesn't apply and can be left blank. For example, the triage, no need to fill out triage. The main thing that we'll be looking at is kind of vitals in nursing care. And these items here, these checkbox items, were created by our nursing team. This is what they requested. Obviously, we can change these to be whatever you would like. But you can enter vitals here. You can also, there's a specific tab to look at, vitals standalone without everything else if you want to just take a quick look. And so the key things are sort of going to be mostly in this zone where you can put in your nurse's notes. If the physician puts in abdominal pain orders, orders are right here with the little syringe. And I'm going to do abdominal pain OBS. And so this will create kind of what we have for our order set. If the patient already had an IV, we can exit this out, because we don't need a second one. It has the diagnosis of abdominal pain, setting the registration status to OBS, MPO, this type of stuff. It has a CBC that's done at my current local time and then in about 6 hours. And it's same thing with a CMP done now and in 6 hours. An initial dose of Zofran and some fluids. If all that looks good, we could just say add orders and those will all get put in. So from the nursing side, the simplest thing is putting in your little brief, checking on the patient or whatever directive nursing comments you want to put in. That text just goes here. So patient moved to OBS room. We could say now, we can hit the plus button, it gets put in. If you need to edit it, you can always hit the chart icon here and that will allow you to edit it. Or if you need to delete it because it was on the wrong patient or the wrong comment, you can just hit the minus sign and delete that out. So for the nurses, this is most of what needs to be done with just kind of the brief updates, checking on the patient or things like that. The documentation that nurses typically will do related to orders, depending on which EMR systems you've used, sometimes there will be in this sort of zone of the chart where you put it in the nurse's notes. And then there's also some things in the orders. We've taken the approach of trying to encapsulate everything that you would document with an order, stay with the orders, so you don't have to do it in 2 different places. For example, let's do the IV placement. So I'm here at the IV. I'm going to click on the chart to say let's document that we did the IV. We just click that. We did it on the left side. We did it in the hand. It was a 20 gauge. We did get blood at the time of the IV. We put a saline lock and TECdoc and it was secure. Again, if there's different wording or different things that you would like as part of this, we can add that in very easily. If there's additional comments, I could put comments here. IMLA applied prior to IV. Then I could say order completed and then save. So instead of documenting TECdoc and that sort of thing on the nurse's side, it stays with the order. The PSC, or that's our term, but for example, if it's grayed out, then that typically means there's a comment that's required. We'd say done. The artifact is saved. So that's documenting order completion. Again, we will add in a piece that has the start time and stop time that will default to the current time, so you don't have to enter anything in if it's the same as the time that you're doing it. And that will be available pretty soon. On the fluids, if we're going to document that, let's say we start the time now, but obviously we don't have a stop time yet and we're still infusing. Instead of clicking the order completed, I'm just going to hit save. And that saves the time that I started the fluids, but then we can come in later and document when the fluids were stopped and then how much. And that sort of encapsulates, for an OBS standpoint, the 2 areas that I think nurses will do most of the documentation, either in the nurses or in the order section or in the brief nursing assessment piece here.
So Eric, the way they do it here is the nurses run the labs. So we'll want to take up an order, and then let's walk through what a discharge looks like, a disposition.
Very good. Okay, let's go back to an order. So here's a CBC and a CMP. If we click we're going to fill in the order. The blood was obtained. This one happens to be at IV start. And then we can just put in the values. So if the 12,000 granulocytes can be 40%, and so we just typically go off of the printout sheet and put these in.
And then I think Laura and Jackie, we talked about the advantage of putting these in. I don't know if you noticed that thing flipped yellow. Put in
Right here.
3 for a hemoglobin, Dr. Wookie.
I can do that. So instead of 13, we'll do 3.
Yeah, and it flips. So did you guys have any time to discuss if we want to go ahead and implement this for the OBS patients? Or do we, because the physician's still going to see it and sign off on it. It's just that this now leads the physician with some reminders and some other components through the care process if we type it in. And Eric, can we avoid typing in some of these things? Like let's say an MCH, like could we just not type that in and it would still be, it's still safe?
It's still, yeah, it would still save.
So we could do just like the big 4 or something, you know, and narrow down what we actually type in. So I don't know, Jackie, if you were you guys thinking you want to go ahead and ask the nurses to go ahead and put this information in, or do we just try to figure out a way to just mark the order off when the CBC is done?
I think we go ahead and have the nurses input the information. Once you had confirmed that, because we had discussed the only concern would be that obviously human error if they entered it wrong. But when you had brought up that the docs still have to, you know, sign off on it, then I think that second set of eyes should be good for that.
Okay, perfect. So that'll be part of the training and review, and we're working on some other options where we might be able to just sort of scan it in and recognize it, but that'll be a little bit down the road.
So one thing you can do is if you want a sort of belts and suspenders thing, we can click on the camera icon right here. And then if I held the lab up, we could take a picture of the lab. And so then you've got, not only do you have the entry electronically that we put in here with the values, but you could actually take a picture of the strip using whatever device we're using to document on. And then hit save. So that's completing a lab. Pretty simple, and the display should be the same order that the display happens to be on the printout, so that as you just kind of just go top to bottom and you can put in the values pretty easily. All right. The physician can go to test results, or anybody can go to test results and click that. And again, it will highlight the white blood cells elevated. It'll highlight that hemoglobin is abnormal and put in the word critical next to it since it's a critical value. And to kind of just draw attention to those items that definitely need it. So if we get to the point where our fluids have finished, we can say stop time is now. We put in the whole 1,000 response to medication. There's no adverse reaction. The order was completed, and then we hit save.
Hey, Eric, can you walk me through, is there a morphine order on there?
No, but we could put one in.
Yeah, let's put one in and let's walk through how we document that. And then I think, Laura, were you telling me it's a 30-minute reassessment or something along those lines for pain medicine?
That is correct. For pain medication.
Are you in the medication section, Dr. Wookie?
I am not in the medication section.
I know it's hard to see when it goes off these screens, these little.
All right. So here we have
It's a lot of morphine.
10 milligrams. Let's assume it's a big person.
Yeah.
Okay, morphine order. Here's morphine. And then, so we'd say we did a slow IV push. response to medication. These are sort of the standard memorized ones, but that is editable. We can make that anything that we want.
Yeah, so Eric, let's say I go ahead and pull it and give it, and then I need to reassess in half an hour and put that information in that their pain is improved. Would I save it and leave it open and then go back into it? Is that kind of how that works?
Exactly, right. So either you can wait the 15 minutes, you know, and then document. Like I said, we'll have in here start time and stop time, and that can be done. Or you can just save it here and say, all right, I'm going to come back to this in a few minutes. Then it doesn't close, it stays open, but it remembers everything you put in. After 10 minutes, you can come back in. We can say decreased pain, no adverse reaction, everything looks good, order completed. Again, any free text comments that need to be in here can happen, and then
This is
that's
Laura.
it.
Can I ask a question?
Absolutely.
Okay, so on that order that you had opened, if a nurse were to click order completed, is there still a way to get back in there to do a 30
Absolutely.
minute? Okay.
Absolutely. So right here, it's under completed, under morphine. I can just click it again and hit this little plus button by the artifacts word, and it comes right back up, and say had some mild itching and redness at IV site, and then hit save. So that's all that takes.
And that re-time stamps it? Because I didn't see an area to put a time.
No, that will be, it does internally timestamp it, but we're going to move that from an internal to a visible timestamp that you can then edit. Like I said, the ones in Texas that we've been using, the documentation and the volume works where you can kind of document as you go. Some of the volumes that you guys have in Arizona, it's a lot more brisk. And so the idea of making sure that we could document the correct time was not something we initially built, but I think that has a lot of value. So that's on the immediate edition list. So that time will be available. I just, again, estimating, you know, between 7 and 14 days, probably a little less than 14, but to get that live for you.
Thank you.
So the stuff that's gray right here, these are things that are future orders. So will be available in 5 hours and 46 minutes.
So those are time physician orders like a serial troponin or serial CBC.
Exactly. So yeah, so when we created the order set, it's the order set's built to do, you know, a 6-hour repeat CBC or CMP, and that can be customized to those specific order set as well.
All right, let's walk through a disposition. And would it be valuable, Jackie, for you guys to see how the doctor does it inside of OBS?
Yeah, that'd be great.
Okay.
All right.
So when the physician's coming online, they're going to add this template, and that's going to be their part. So they're going to walk through these things. You can see where, can you show up above there, Dr. Wilkie, just a second there? They're going to activate that abdominal pain observation order set, which will trigger a lot of those orders that need to be in place to qualify for observation appropriately. And then they're going to have criteria that needs to be selected. So this is for making sure that they're appropriate candidates for observation, not only from a payer standpoint, but from a clinical standpoint. So the doctors walk through this kind of decision support right there. And then they need to mark these things as negative. So let's say I'm a doc and I'm like, yeah, I want to observe my abdominal pain, and they turn out to be, and they're pregnant. Well, as the doc's working through, is going to say, oh, wait a minute, maybe I should not be observing this patient. Let me figure out what I'm thinking here. So there's these little reminders and little triggers as you walk through it for the physician to try to make sure they don't forget some little thing that could mess us up.
And Keith, unfortunately, I don't have Fusion Narrate available for me.
Yeah.
But I could dictate this and say, right lower quadrant, abdominal pain times 5 hours, ultrasound, non-diagnostic, etc. Basically we'll observe, and so basically we could put the reason why we're putting them in under the exam. I'm going to change to tender right lower quadrant, no rebound. And then we've got kind of the default plan, and then this is where the physician's going to document their course. I say pain controlled at time of OBS placement. And so then we want the physician to document at least once an hour or more frequently, depending on the condition. And then when you make a decision to send them home, I can say, here are the criteria to send home. They have to have acceptable vital signs. We don't say normal because technically if you've got a heart rate of 101, that's an abnormal vital sign, but that may be appropriate to still send home. Pain is significantly improved. The workup is negative. Etiology is more determined, and then this would be criteria for hospitalization. And then once the decision to say, okay, even though they may not be discharged from the emergency department, but we've made the decision that we're done with observation, we can timestamp that, and then we're planning on discharging the patient. And so then we can come to disposition. And I'm going to collect abdominal pain. It's going to be in the right lower quadrant, and it is not intractable. I'm going to say a disposition to home. Discharge is good. I would typically add follow-up, but I can't discharge them unless I put a specific follow-up. I'm just going to click no follow-up to allow me to do that, but otherwise we can select, since I don't have all the dignity specialty follow-up physicians in there, it's not fully populated. But then we can print the instructions from here. That will just open up a print sheet that we can do. And then once I'm ready to discharge, I click the Ready for Discharge button. So it tells me that there's some information missing. It's going to highlight labs that are outside the normal range. It's going to show me that there's still a lot of things pending because we haven't closed this one out. This is kind of a med reconciliation, so yes, we're going to continue taking. And then I can click finalize if I'm signing the chart and I'm done. Otherwise, if I'm going to come back and document, I can just say approve because I'm going to do some things a little bit later, but I want to let the team know this patient's ready to discharge, and I'll continue charting later. What that means is the patient will highlight yellow, indicating that they're ready to go. The nurse can still continue to document and complete orders that are outstanding and continue to finish that portion of the documentation as well. I'm not signed in as a nurse. I can log out and log back in. But basically on the disposition side, it will have an additional button that basically will have the nurse saying, okay, I am now ready. The physician said it's okay for the patient to go home, but that's just the physician. The nurse who really does all the work can then say, yes, the IV's out, the patient's actually safe to go home, and we're clearing the patient from our side. And then the registration side, which will be done external because this is an OBS, we'll take care of that separately. The front desk will not need to do that. But then that will be discharged completely out of the system and off of the board at that point.
Yeah, in fact, Jackie or Laura, you could probably sign in on a Chrome browser and go to Glendale and look for this OBS test patient and and see what it shows you under disposition. Maybe even share your screen with us and show us what it looks like.
Or I can, oh, I'm not on the demo site, so yeah, I can't use the demo nurse.
Yeah, it would need to be Jackie or Laura.
One thing we'll have to say what time the patient left. They won't be able to discharge out of the system unless we have the time the patient left from the ED. And so one of our goals was to try and make something that was fairly simplistic, but yet gave a medically, legally sound and billable document. In knowing physicians, they don't attend training and they don't read instruction manuals. And so we're trying to build something that if they clicked around and pressed things, they could figure it out without having a lot of training. So most of the time when we do this with our new nursing hires, a lot of the feedback we get is that's all. You know, should there be more? Are there more things I'm supposed to click? And usually there are not, which is kind of nice. But we can customize content and build things to the nursing level that they want, or you know, add or take away things that were important for them as well.
Makes sense. So I logged in and it's highlighted yellow for me. I'm sorry, I can't share my screen because I was already logged in from the beginning, but I'm on a different computer logged into it than we're on to the meeting.
No problem. If you go to the disposition page, do you see a button?
Yep. Yeah, I see ready for discharge as an option for me.
Perfect. All right. And then so if all the orders are completed to your satisfaction and all the nursing documentation is completed to where you want, then all you have to do is hit that ready for discharge, and that will, I believe that may just take them off the board and send it over to the front desk to do so.
Sorry, can I back up real quick and ask a question?
Of course.
I just was able to pull this patient up. So if I'm in disposition, the button that says ready for discharge is what I would click as a nurse.
Correct.
And then
yep.
I just fill all that out and then click now, then it's done?
Yeah, it is done. So it has disappeared off the board.
Okay, thank you.
Right.
Yeah, and you should be able to share your screens. If you just go up above, there's a box with an arrow pointing into it. On mine, it's in the upper right-hand side. It might be lower down on your screen. It's usually right next to like the leave button. And if you click it, it'll push it.
Here's something. Let's say we did that accidentally. Like, oops, we didn't mean to do that. This little Band-Aid icon is our registration section. And here's our OBS. And so if we need to reactivate the patient, we typically can. But again, that's a pretty rare, there's an undischarged button. So this one's still active. So if I discharge them, I come to our recent it's going to be way down there, 113 items, because these are all live patients. But anyways, they could be undischarged if it happens accidentally. But like I said, hopefully pretty straightforward and pretty simple. I would, I'll take a couple screenshots of some of the nursing sample things, or as you guys actually do this for real, if there are things that you see that you're like, hey, I would like to change the wording of some of the questions, or on the order, I would like to add in some additional questions that I want to capture at the time of the order. Just let me know. You can also click this little button right here. That looks like an envelope, and and that it gets emailed directly to me. So you could say, you know, you're a giant idiot for doing this. Please change the wording or whatever you want, and they'll kick it over to me, and we can get that done. If it's something that needs to be fairly immediate, that's very easy to do. Just give me a call on my cell phone. To give you an example, this may be a little in the weeds, a little technical, but if we go to our template here, IV fluid therapy. So if there are additional questions, so we have, you know, start time, stop time, fluid infused, but if there's something else, another checkbox or drop down or anything you want associated with the IV fluid, we just add it in here. We hit save, and then the very next time that you use it, it's available. So like I said, hopefully we can make this quickly and easily customizable to the thing that works best for the workflow.
Can you show them how to do macros real quick and update the drop downs?
Yes, I sure can. I'm going to go into this test because it's got Keith Butler and it says test. I think that's probably safe. So let me come into nursing. And let's say here's my triage section. It's got all caps. And I'm going to say all these are normal. And I'm just going to pick a potentially dangerous level 3 as my usual one. So under triage, I'm going to say save section macro. And I'm going to say normal, keep his pin button and hit save. So now if I take these out, get this back to kind of the initial state. That can go back. So all I have to do is hit normal here, and it will automatically fill this out for you. You can even put stuff in the text boxes, and it'll remember everything you had for this grouping, and it'll stick it in there. So those are macros. If there are things that you say over and over, informed consent signed, for example, with witness. If you click this little cog wheel, it will then remember that phrase. So if I take it out and I start typing informed consent, then there it is, and you just select it. So if you want to remember common phrases, you just hit the cog wheel. And then if you want, like I said, macros, then you can build those in using the Manage Macro screen or the Manage Macro button. And hopefully, Keith, hopefully you won't beat me for saying this, but if we are able to get this in place and kind of do what we would like to do, there is a partnership with Fusion Narrate that allows for voice recognition. So instead of having to do a lot of typing, you can do a text to speech to text that will go into the fields. And the other thing that I found was very helpful is if I'm doing an informed consent with a patient, there's obviously the paper that we have people sign, but let's be honest, nobody reads it. And a lot of time it's like, hey, we need to sign this in order to do this procedure. And maybe a couple things are mentioned, like, there could be bleeding or whatever. And the patients just sign it because it's put in front of them. If you walk in the patient room and you click this microphone button right here, then that will start a recording. And so you can be like, Mr. Smith, we need to do a central line, which is an IV catheter that goes into a large vein. The reason for this is your potassium is critically low. We have to infuse you with potassium, but we can't use the small IVs that we have. The risks to that are going to be bleeding. and possibly a collapsed lung. It's called a pneumothorax. The complication of that would require a chest tube, et cetera. You can go through that. Do you have any questions, Mr. Smith, about this procedure? And you'd say, no, you explained it fine. Thank you very much. Do you consent to having this done? Yes, I do. And that's then all recorded and then attached as part of the chart. And so when we've had some cases where we've reviewed things, that has a lot more gravitas than kind of the paper that gets signed. So that's a useful thing. The camera icon, again, we'll take pictures if you got a very contaminated wound, or you want to do a before and after picture of what it looked like before irrigating and cleaning. You can add that to the chart as well. And then if they come in with documents that get scanned in, you can upload them with documents. So if they come in from outside, and all that will get attached to this particular chart as well. It's probably nothing that you were interested in, but you got to be careful if you start asking me questions. I'll kind of go off on a different thing. So,
any questions come to mind, Laura or Jackie, on that?
I don't think so. I just wish we could switch to this completely.
Yeah.
We tell Jane. Tell you have poll, Jackie. Tell Jane.
Not enough pull.
So yeah, just both of you, Jackie, Laura. I want to make this user friendly and something that is helpful to the team. And so again, as you see content or things that you would like, this changes every month. There's something new every single month that we do, and it's largely driven from our user base and feedback. So a lot of times it won't happen as fast as we want it to, just because I've asked the programmers to be very careful and test things before they release it, because I really hate it when it blows up and causes problems. And so, but like I said, a whole variety of things are all based off of stuff that the users want that makes it easier for them to do. So please do not hesitate to giving us critical feedback.
And then one other point that this is more of a request. You see that little icon in the top that looks like an envelope?
I talked about that one, but
okay, I'm sorry, I missed that. And then so when you guys are working on it, Jackie, and I think I have your phone number, Laura, but if not, just text me or call me, and I can help you with stuff, while we're getting the hang of it. And we anticipate that since there's just not going to be a ton of OBS patients on any given day, that folks will get a little rusty in the system before they use it. And so we would just anticipate that they can just call us and we'll walk through it, nurse, doctor, tech, whatever, what have you. We say PSC, you guys say PAR. It's basically the same function. But in this case, all of the PAR functions in TECdoc are actually going to be handled inside of Evident. So that'll be a little different. So if you see some wording like that, you can kind of just ignore it. And that's I think pretty much it.
Well, and if you want to add an image of the patient, then so
okay,
yeah. So again, Keith was like, "Hey, we need to do nursing education." I'm thinking, sure, it's kind of clicking a couple boxes. It's pretty straightforward, so I hope I'm not wasting people's time. But hopefully, it's easy. That's our goal, is to make it easy.
No, we appreciate your time. Laura and I had specifically asked for it because we just want to be able to be a resource too for the teams, like you said, because I don't anticipate this is going to be used all the time by all of nursing. So we just wanted to be able to be a resource too.
Oh, fantastic. And then too, we can get you in contact with some, like the 3 centers in Texas, the phone numbers, because obviously the teams have been using it for years there. And so 24/7, if like, hey, how do I do X from a nursing standpoint, you can pick up the phone and call any of those, and anybody would be super happy to help. And if happens to be any hiccups, which hopefully there won't be, but that resource is always there as well.
Okay, that's great.
Keith, are you going to send out this video since you're recording it?
You know, I think that and those 2 documents that we sent out earlier would be a pretty good base training, and then we could kind of go from there. Or would you like to try to do something like this with a group of nurses from maybe based at Chandler?
I don't know, Jackie, do you think we'll set up like a meeting to have a group education base, or are we going to do daily?
I anticipate it'll probably be more daily, kind of
Yeah.
train the trainer.
Yeah. Okay.
Okay. Let me make sure you guys get a copy of this this video, and then you guys were able to get that email that had the quick sheet and the information on the wiki that talks about it.
Yes.
Okay. What were you able to get any kind of relief from the dignity powers that be on the YouTube videos?
No.
So I don't know how that works, because there's a lot of that training for like special questions and more complicated things. That's all what they're pretty brief videos, and they're all kind of right there on our channel. I did also request with Schuler, but you know, I don't know if there's another way around it. Obviously, anyone can use their home computer or their
Hey,
phone to
Keith,
watch.
if you click over to a guest, if you've got your phone or a laptop and you go to the guest Wi-Fi, do they block YouTube on the
No.
guest network?
No, because I could watch them on mine, but these guys couldn't see it on theirs.
Okay.
I
So
wonder
if it's-
though, I wonder if we could, I wonder if because I have like all like in touch iPads and stuff. I wonder if that couldn't be something that we could use those for sure, at least right now at Chandler Germain, to let them view the videos, that they could do it while they're at work. I can work on that with Laura. I think we can probably make that happen.
Yeah, and we can move them over to whatever platform maybe Dignity preferred. And also this works with tablets or phones. So
Okay.
if you want to check the volume at Chandler and you're with your phone, Laura, you can just sign in right here with your phone and it'll pop up and show you the volume, and you could even look at the chart. And you can also use it at the center. I don't know what Dignity's rules are on BYO device, but the system is capable of it.
So just to kind of put this in perspective, I'm just using an iPad, so this is not even a desktop system. So it's a little, and I'm about 7,000 miles away, so it's kind of nice. So my workflow is I typically will bring my iPad and I just walk in the room and kind of click the buttons as I'm talking to the patient. Sometimes I'll actually hit record for the HPI, just so you hear in the patient's own words some of the things. And that Fusion Narrate is super nice. And Keith, the philosophy that Keith and I have is, that's something that should be available for the entire medical team, not just the providers that are seeing, like nurses do the real work, let's be honest, and so having the ability to dictate and voice recognition for that is nice. We do have, you don't see it on my iPad, so unfortunately, Keith, maybe if you showed your screen on the text boxes, these areas, on a desktop system, you'll see a little red microphone in the corner, and that actually uses Google text, voice to text. And not as good as Fusion Narrate, but it is available on any system that has a microphone that's Chrome, either Mac OS or Windows OS.
Okay, cool. Let me get the copy of this and get it over to you guys.
Thank
Before
you.
we hang up, can I ask you guys a completely random question that has nothing to do with this, what we're doing right now?
Yeah.
So, when I pull up AG Mesa Hospital and I'm doing a comparison, like between T-System and like my dashboard, that tells me like how many patients we saw on a certain day. patients pop up under tech that I can't find in T-System.
Brian Tiffany did a bunch of homework on this a couple months ago.
Okay,
And,
I can ask him about it.
well, no, I'm happy to tell you. There's some problem with the interface where the T-System dashboard doesn't get accurate for about 3 days. And so he uses this one, and you're
Okay.
obviously welcome to use this one. If you want, I mean, it might make sense to just do a kind of a line by line comparison, because you can click it, right? So you see Thursday, just click it, and it'll show you the individuals that make up that component.
So which facility are you looking at?
She's at AGH Mesa.
Yeah,
Okay,
AGH Mesa.
Let me switch over to Mesa. So if I switch to Mesa, and I'm going to click on Thursday, which is, I guess, today.
It is for us.
Yeah, you'll see like this external chart isn't populated yet. So these are all the T charts that haven't kicked over. And this patient list is coming from the ADT feeds out of Evident and CPSI. And so we were noticing that too. So it takes a little bit for the T system to kind of filter through and sort of match the patient. So I think our list is more accurate on the short term.
Okay, so it's weird because your list looks different than mine.
Did I click the right one, Mesa?
Yeah, you did. Okay.
Well,
do you want to try to share your
different
screen, Jackie? It's in that. I'm going to go ahead and stop the recording, but it's in that upper. For me, it's in the upper right hand corner.
Part of the difference is this is